And today we're bringing it to 100% of the workforce must stay home.
Charles Walker, Outreach Project Manager for the Community Health Center of Niagara.
And my name is Mark Laurie. I am the Superintendent of Schools in Niagara Falls. I'm starting my 8th year as School Superintendent.
Hi, my name is Mark Batesold. I'm the Executive Director of Heart, Love, and Soul.
My name is Sister Beth Brosmer, and I used to work at Heart, Love, and Soul, and I retired a few years ago.
Robin Kruger, spelled with a Y, not an I, and I'm with Community Missions of Niagara Frontier Incorporated, and I am the President and CEO here.
I am Laura Pennington from Pinnacle Community Services, and I am the CEO and President.
My name is Rolanda L. Ward, and I'm an Associate Professor of Social Work at Niagara University, also the Endowed Faculty Director for the Rose Bentley Ostapenko Center for Race, Equity, and Mission.
Kathleen Granchelli, YWCA of the Niagara Frontier, CEO.
Brian Archie, Team Integrator, Create a Healthier Niagara Falls Collaborative.
My name is Cliff Scott. I work for the Niagara Falls Housing Authority. My title and position is Executive Director.
My name is Bernadette Frangione. I work for Catholic Health, and I am in business development.
2020 was a moment in time that the world stopped. Life as we knew it ceased to exist, and we were catapulted into a space of fear and uncertainty. A life-taking pandemic was upon us, and we had no clue what to do or how to protect ourselves and those we loved. From this uncertainty, a thought was formed, and from it, community health as we knew it was turned on its head. This is the Niagara Falls Health Equity Task Force, a story of us.
And received a call from Dr. Rolanda Ward asking, what can we do for our community, for those that need help, that are often overlooked.
Staff from St. Mary's were talking about the number of individuals that they were seeing in need, and decided in conversation and collaboration with Niagara University to do something about it. And so I received a call after their first meeting and said this community group would not be complete without community missions. So I was certainly happy to become involved, looking obviously at the population of individuals that we serve. Certainly the individuals that we serve have a variety of concerns, and I was just very happy to be asked to be a part of it.
And what we realized in the community, there was a lot of people who were not only not aware of what was going on, but didn't know how to find resources and things to help them deal with what was going on.
We were all nervous about what life was going to look like for us after the governor declared an emergency. And then when we started to see numbers, the number of people who were impacted in Niagara Falls as well as New York State, we started to consider, well, what do we need to be thinking about when it comes to our BIPOC community members and those who work jobs that are day shifts.
Also, now I have information that points out that there are clear inequalities, clear disparities, clear inequalities, clear inequalities.
Why did you join, and why did you care?
I live in this community, I work in this community, and you can see the panic on a lot of people's faces when the deaths start totaling up and things like that. So people were looking, where do I get, help? How do I get tests? And so it became an issue. Whereas living in this community, you had to understand that there were some people who just did not understand. And then there was some, with some of the things you would hear, about what was going on, putting something in your head and gonna track you, and all of these different things that was coming out. But in the midst of it all, there were still a lot of people dying from this thing. And so it became very important that there had to be an effort, a collaborative, something that really needed to get into the community and begin to educate and help people to find resources.
I want to make sure that in all areas that our students are treated equitably, fairly, with attention, with need. And when we're doing that for students, we're taking care of parents. When we're taking care of parents, we're taking care of the community. Now you multiply students, parents, family members, that is the community. So I think from where I sit, I wanted to have a seat at the table to make sure the resources that we could share were available.
Those are people that are in my family, and I want to stand up for people that need me to help tell their story and stand up for what their needs are.
And our society doesn't provide the same tools and opportunities and access that, say, I would have had when I was a kid. And it's just not right. So I want to see those inequities removed. I want to see those barriers overcome.
What do you think was the biggest success that came out of the task force?
The biggest success of the task force is getting this group together and keeping this group together.
There is a stronger relationship and bond between the multiple agencies of this community. There is a knowledge of who does what, so that we don't overlap services, and that we could pick up the phone and make a call and get some action done.
Because one thing we all recognize, once there became a vaccine, it wasn't in our community. And so people had to try to find a way, where can I get this vaccine? Where can I get a vaccination? Where do I go? This and that. And so it became an issue where transportation, so someone had to advocate. And so by the task force doing the work that it was already doing, it became the perfect advocate for the community to make sure those resources were placed inside communities that needed them.
So being able to bring vaccines and information and education and food and other needs directly to where a person is living is just an exciting and exhilarating opportunity for this task force to be a part of, and just demonstrates the level of care, concern, and compassion.
Peacemaker Ezra Scott says by bringing the clinic right into the heart of this Falls neighborhood, it will help those who otherwise wouldn't have access.
Poverty, it creates many issues.
Scott says they want to make sure people have the right vaccine information.
There's a lot of information to where there's false information that's getting out there. You have some good information. You also have some people that are on the fence.
So what would you say to someone that has those fears?
So I would say we're here to help you. We're here to help you make an informed decision.
Here, we have all found opportunity to excel, not just in our specialty, but being able to really connect and bring resources to people, right? Like the model has been shifted. We're not waiting for folks to come to us, not one specific agency, not one specific hospital, not one specific community health center, but let's go to them.
These services and these needs were met in a person's own community, and that's how we're going to get through this and any other dilemmas that we deal with, is bringing things to people, not insisting that people come to you.
The biggest success is the clarity of the numbers. This is not like people feel like this, you kind of feel that way, or, they always do that. This means that this percentage did not get what they needed. So who's going to fight with the numbers? Those are real numbers, and those numbers represent real people. And that should speak to the leadership of the city, to funders, to anybody that's looking at anything, that they say, well, how do we know we need this? Because we have the numbers that support it. Clearly, there's just no ambiguity.
What has been left undone at this point in time?
It's the same issues that many communities have: housing, childcare, poverty, that we still have to work on every single day.
There's going to be a new pandemic, and the pandemic of food insecurity, homelessness, housing issues, all of the things that have been dealt with by the task force are by no means accomplished.
To ensure that people still have the same access to services as they did for these 36 months.
There will be a community issue that will require that same cohesive group to coalesce not look for any one person to get the credit, and get focused on action. So I think what's not done is a need to make sure we stay together, have the stamina, and keep practicing the same principles that brought some real wins to the community and wins to people.
We want to create systems of care that improve people's health as well as their ability to live well and whole in this community.
We've got to continue to add partners, we've got to continue to look for issues, and we've got to continue that approach of no credit looking for, get the work done.
What is your hope for this community?
It's listening to each other and really supporting one another.
That each person would feel they're worth it. I need to take care of my health. I want to take care of my health, and I can do this.
People would be employed where they want to be employed. They'd be housed where they want to be housed. They would eat the way they want to eat. They would have every opportunity that they want, no matter who they were.
We build neighborhoods that create supports within them for the people that are living there.
I love multi-generational opportunities. I like sharing meals, walking and sitting on porches, and having time to be in relationship with my neighbors.
We want community members to have access to new information, to innovative strategies, and for them to drive the care and concern for each other on a daily basis.
I think if we continue on with this sort of model that the task force has been able to elevate, I think that it will prove positive for the health and well-being for the residents in the city of Niagara Falls.
I would just like to I'd like to thank Dr. Ward. I mean, she always raised it to a level of professionalism that made it worthwhile for me to continue being that.
Thank you.
I want to thank Dr. Ward for bringing the group together. If it wasn't for that first meeting where they got some stakeholders involved.
Thank you. We thank the task force, all the members, for the work that they're doing as well.
Thank you.
I'm honored to have been part of it. I have to tell you, I learned by listening from people on that task force. And I am very impressed to the other task force members for your stick-to-itiveness and your stamina for showing up.
Thank you.
I'm very, very proud to be a part of this organization.
I would like to thank Dr. Ward for making that one phone call. I would say to people to follow her lead to make the one phone call.
Kudos to Dr. Ward and to Kaylin for herding cats, I call it, and keeping this group energized and working and moving forward.
I'm just grateful for sacrifices that during a period of our world's history, that people thought about sacrificing themselves and their time, as well as their agency's resources, to put it in a pot that was stirred, seasoned by the personalities of all the task force members. I am grateful for the laughter that was on our meetings, in our meetings when the work was heavy. And I'm just grateful for everyone always saying yes. I can't tell you an example of somebody telling me no. And I'm always prepared to go back and ask people for more, but I literally can't even remember anyone saying no. That's the beauty of the world that we want to promote. You did something wonderful in this community, and I know that we are positioned to do even greater things.